Welcome. Good morning. I'm really happy to see you here on this beautiful, brisk, sunny December morning. My name is Wendy Peterson, and I'm the director of the Senior Services Coalition of Alameda County. Is the mic okay? And on behalf of our coalition members and our steering committee, I want to welcome you all here today to this event, this convening, Making a Difference. I would first like to thank our sponsors, Alameda Alliance for Health, Kaiser Permanente, and Center for Elders Independence. Without our sponsors, this event would not have been possible. So I'd like to give them a round of applause. And I don't know if Scott Kaufman is here yet from Alameda Alliance, but thank you. I believe Linda Trowbridge is here from Center for Elders Independence. Thank you. And I think that Mark McBain and Janet McBride are here from Kaiser Permanente. Maybe not, but thank you to all of them. So before we get started, some logistics and housekeeping. You should all have a program, and there's a stack at every table. So if you don't have one, grab one from the stack. The program includes our agenda, speaker bios, and the descriptions of the discussion cafes that we're going to have during lunch. In an effort to be green, we've made most other materials and PowerPoints available on the conference webpage. And that webpage address is at the bottom of your agendas, along with the Wi-Fi information for Nile Hall. So if you want to access them today, you can. Restrooms are out the side door to my left. You'll note that we do not have a break on the agenda, no stretch break or anything. And so please feel free to come and go as needed during the morning. Sorry we lost that time. We just wanted to cram everything into the agenda. So before we really dive into the program, I'd like to frame the day a little bit for you. And I want to say a couple of things. First, while we moved the date of this convening into December in order to give us some wiggle room after the election, we didn't anticipate just how much the policy landscape would be shifting under our feet. We have not radically changed our program today in light of the federal election results, but we will spend some time in the second panel and in the discussion cafes during lunch talking about this. And I want you to feel free throughout today's conference to voice your questions and your concerns during the Q&A, during the discussions. We don't want to ignore what is, what the future looks like. The Senior Services Coalition will be staying on top of policy issues affecting seniors, both federal and state, and we'll be informing and engaging you as the new year unfolds. I will say this, though. We are all still here, right? Yeah. And we still have a lot of work to do to improve outcomes for older adults in Alameda County. Alameda County's aging population is increasing in number, economic insecurity, and poor health status. And we all recognize that no one sector or silo can address this phenomenon. This is the third year of this conference, and each year we've used this convening to bring our silos together to talk about how we can make a difference in the lives of seniors in Alameda County. This year, multiple county systems that touch the lives of seniors are beginning or in the midst of a transformation. And some of these systems are in medical, health, and social service realms. And today, we're going to learn about those initiatives and spend some time exploring the intersection of healthcare and community-based supports. It occurred to me as I was putting this program together that it's exactly in times like this, when big systems are being redesigned, that it's really easy to forget the reality of the people who the systems are meant to serve. It's commonplace to take consumers for granted along with their lived experience, and to wind up with systems that are anything but friendly, and that are just as difficult to navigate as the systems that came before them. So I'm really glad that we have so many older adults here from the community in the audience today. I know that they will help us. They will help us remind ourselves that their experience is what counts. When we talk about care delivery and systems transformation, we have members of the POCC, the pool of consumer champions, and United Seniors of Oakland and Alameda County here today. So I'm glad you're joining us. Yes. This morning we're going to hear about a multi-year study of homeless older adults in Oakland. These are older adults who've already fallen through the safety net. But many of us in senior services are concerned that these homeless seniors are a portent, much like a leading wave of a tsunami is a sign of the bigger wave that's going to be coming. And we're very concerned about that. Across the economic spectrum, older adults are challenged mightily. From the homeless senior living on the streets or couch surfing, to the senior living in low-income housing, juggling resources to comply with doctor's orders, to the older adult facing the loss of her housing as rents increase, to the senior struggling with mental health challenges along with complex medical needs, to the older adult living in her home on a fixed income that barely covers basics. Throughout Alameda County, older adults are living on the edge. We need to be thinking about them all as we work together to develop systems and not silos. So with that, I'm going to give you a brief overview of the day. We'll start with a keynote from Dr. Margot Kuchel. Next we'll hear, and you'll see this on your programs and on the agenda. Next you'll hear about the systems transformations that are, next you'll hear from a silo bridging panel that will explore the territory where healthcare and community-based services intersect. Next you'll learn about systems transformations that are underway in Alameda County. After each of the panel presentations, we'll have time for audience Q&A, and there are 3x5 cards at all of the tables. As you think about questions, write them down on cards, and we'll collect them during the Q&A. During the keynote, Dr. Kuchel is hoping that she'll be able to create some time for questions from the audience. If we run out of time, because Margot has got to run out the door for another commitment, we will still collect your questions and we will get them to Dr. Kuchel to answer. So, know that. After the plenary, we will break into small group discussions for a working lunch designed to help you synthesize the morning's information and also to capture your insights and ideas for our community wall over there. So you may leave here informed, motivated, alarmed, and inspired in equal parts. And I think if that's the case, then we will have done our job. So now it is my honor to introduce Dr. Margot Kuchel. Dr. Kuchel is a professor of medicine at UCSF at Zuckerberg San Francisco General Hospital. She is the principal investigator in a study of the causes and consequences of geriatric conditions in older homeless adults. and is co-principal investigator of a related study that examines the role of family in rehousing homeless older adults. Her research seeks to inform clinical practice, program development, and policy. And it's wonderful to welcome Dr. Tricia. So you have control of that. Yes, you have control of the slides. You can actually move them forward.
Wonderful. Thank you